Hello and welcome back. Today, we're diving into something that honestly sounds like it's straight out of a science fiction movie. We're talking about a simple piece of chewing gum that can actually trap and neutralize viruses like the flu and even herpes right there in your mouth. So how does this amazing idea even work? Let's get into it.
Just think about it for a second. What if we could stop a virus before it ever gets a chance to spread? We all know that most transmission happens through our mouths and noses. So what if we could set up a little trap right at that main entry and exit point? Well, that's the revolutionary idea we are exploring today. And believe me, the stakes here are incredibly high. Just the seasonal flu, by itself, costs the U.S. economy more than $11 billion every single year. That's from things like lost workdays and healthcare costs. This isn't just about getting the sniffles. It's a massive hit to society and the economy that we deal with over and over again.
Right, and that staggering number really shines a light on a much bigger issue. Even with everything we have now, we're in this constant battle against viral threats. It's pretty clear we need some new, innovative tools to add to our arsenal.
And if you want to understand just how huge this problem is, just look at the herpes simplex virus, or HSV-1, the virus that causes cold sores. Get this, a mind-blowing 2/3 of the entire world's population is infected. It's a really powerful reminder of just how common and widespread these viruses truly are. And here's where we see a major gap in our defenses. With the flu, you've got low vaccination rates, plus the virus is always changing, which makes the vaccine less effective. And for herpes, it's even more of a challenge. After decades of research, we still don't have an effective vaccine. It's this exact gap where a whole new kind of defense could be a total game changer.
So, if our usual strategies aren't enough, where could a new line of defense possibly come from? Well, researchers found an answer in a very, very unlikely place. A simple piece of chewing gum.
The basic strategy here, as one publication put it, is simple but redoubtably effective. So instead of waiting around for your immune system to kick in, the gum goes on offense. It targets viruses right in the saliva, which is their main breeding ground and launchpad for transmission, to slash the viral load in your mouth and cut down the odds of you passing it on.
But wait, how can a piece of gum actually trap a virus? The secret is in some really clever biochemistry that the researchers have nicknamed molecular glue.
So, the secret ingredient, the real hero here, is a protein called FRIL. And it's totally natural. It's an antiviral compound that comes from lab beans, which are grown all over Asia and Africa. This little protein is the powerhouse that makes the whole thing work. The way it works is it's so elegant. So as you chew the gum, it releases that frill protein into your saliva. That protein then acts like that molecular glue we mentioned, latching right onto any viruses floating around. This grabbing action basically forces all the virus particles to clump together into these big, useless blobs. And once they're all clumped up, they're neutralized. They can't infect your cells anymore. You just swallow, and they're gone. Okay, so that's the theory. And it sounds great, right? But the big question is, does it actually work in practice? Well, let's take a look at the data from the lab studies. The results are, frankly, spectacular. In the lab, the gum cut the viral load of common flu strains by over 95%. For herpes simplex 2, it was a 94% reduction. And even with herpes simplex 1, it still hit a 75% reduction. Those are just incredibly promising numbers for something that isn't even a drug.
And listen, this isn't some one-hit wonder. The same research team had already made a version of this gum that targeted SARS-CoV-2. And guess what? That gum also reduced the viral load by over 95% in patients' saliva, and it's already in human clinical trials. Having that precedent just adds a ton of credibility to this whole technology.
So, what does this all add up to for the future? Well, we could be looking at a powerful and completely new kind of tool for public health.
Of course, this immediately leads to the number one question, right? If this gum is so great at trapping viruses, does that mean we can just toss our masks and forget about vaccines?
And the answer is a very clear, very emphatic no. The researchers are really clear on this. This gum is not a replacement for vaccines or other safety measures. Think of it as a powerful complement, an extra layer of defense that hits the virus in a way that other things don't.
especially when it comes to stopping an infected person from spreading it.
And the potential uses for this are just huge. You could use it with vaccines in high-risk places like hospitals, or to give an extra layer of protection to dentists and doctors. The vision even goes beyond people. They're looking into adding this protein to bird feed to fight things like avian flu. It's all part of this One Health idea, which recognizes that our health and animal health are deeply, deeply connected.
Look, for any public health tool to really make a difference, it has to be practical. And this gum just checks all the boxes. It's good for at least 2 years at room temperature, so it's easy to ship and store. It's made to clinical grade standards, it's free of toxins. Really, its simplicity and how easy it is to use are probably its biggest strengths.
The lead researcher, Henry Daniel, really captured the whole point perfectly. He called it a timely innovation to prevent their infection and their transmission. See, it's a proactive tool. It's not just about protecting the person chewing it, but about breaking that chain of transmission to everyone else.
And this just leaves us with a really fascinating thought. We're so used to thinking about disease prevention in terms of shots and prescriptions, but this totally challenges that. It suggests that the future of public health might be hiding in some of the most unexpected places, maybe even in the checkout aisle. Could an everyday item like gum actually be one of the keys to stopping the next big outbreak? It's a pretty exciting future to think about.